think it's important to begin with kind of the history in that both of us began our professional careers as physical therapists, and Greg in the early 1970s, 1971, and myself in 1977. And as we worked with patients doing traditional physical therapy, we began to realize that there were some holes in the care that we wanted to give our patients. So both Greg and I had our beginnings as physical therapists at the Kaiser Vallejo program. Greg for 7 years, me in the 6-month residency. That program was primarily directed toward the treatment of neurologically impaired patients. We did see orthopedic patients, but our focus there was the neurologically impaired patient, someone who'd had a stroke, someone who'd had a head injury. When you're working with this type of a patient, you're looking at function. If someone walks into our clinic and they're complaining of back pain, the typical physical therapist zeroes in on, I've got to get rid of the pain. But a functional manual therapist, because of our history, the first thing we look at is, well, how does that person with back pain walk? How does that person with back pain get up and down from a chair? Because we've been trained from the very beginning to look at function. And we've realized that by examining and analyzing one's function, that helps you to determine the true source of their pain or their disability. So in the early days, we focused primarily on movement reeducation. Then as we began to study in the physical therapy profession and we learned all about joints and how to mobilize joints, that took us to a next level. We realized that you had to have mobile joints in order to move your body, and there were techniques of mobilization that really helped. But then in the mid-70s, Greg began to realize something was missing entirely from our profession, and that was the addressing of the soft tissue or the fascial system of the human body. And in the mid-70s, there were people outside of our profession that looked at this, but no one within the medical or physical therapy profession looked at the fascial or soft tissue system. And so Greg in the mid to late 70s said, this is something that we should be treating as physical therapists. And he basically introduced to the physical therapy profession, first in the U.S. and then throughout the world in several other countries that he's presented in, the whole concept of soft tissue mobilization. Well, that was just the beginning, because as we begin to look at the integration of the soft tissue system with the joint system, with movement, we began to realize that our training philosophy needed to change. In the early 1980s, there were all around the world several locations, Australia, Scandinavia, and the U.S. in Northern California. People began to talk about stabilization. We didn't even use the word core back then. It was just stabilization. And our contingency in Northern California was the only one that had come from this function-based background. And so instead of just looking at having patients cognitively or actively brace and stabilize, we began to look, how can we facilitate the body to automatically engage its core? Because that's what is normal about the human body. If you watch young infants grow through normal growth and development, what you see is that they sit, they roll, they crawl, all very efficiently if they have an efficient system. But we as adults have sometimes lost access to that normal strategy. So the evolution of functional manual therapy was, let's look at movement. Then we realized the mobility of joints and soft tissue were very important to allow for efficient movement. Then we realized that there were complex strategies of motion that we needed to facilitate the human body to be able to perform. And that led us to the very kind of last part of the development of functional manual therapy, which is functional mobilization. So instead of laying a patient down and just mobilizing a single joint in a non-weight-bearing position, Greg developed an entire approach to mobilization of every joint, every nerve, the viscera, the soft tissues of the human body that are done in functional activities and functional movement planes, so that if you come in and say, I have a shoulder that doesn't lift more than here, well, there are some standard things we do to loosen up the joint and the soft tissue, but eventually our treatment must mobilize you while you go through your motion. And the exercises and activities that we give you must reinforce that new gain mobility. So the evolution of functional manual therapy came about because, as Greg said earlier, there was always this drive to help a patient reach their optimum potential. When Greg and I in the 1970s first began developing the functional manual therapy approach, we developed an institute through which we could train other therapists, and this is the Institute of Physical Art. And we thought about what do we want to call ourselves, and the reason we chose the Institute of Physical Art is because we like to view ourselves as artists. We like to think of the human body as a potential art form, and it's our job to help sculpture and model each human body into the most beautiful art form it can be. And I can take a scoliotic patient, someone whose spine is twisted and rotated, and help them find their potential, their beautiful art form. It may not look the same as their neighbor, but for them, it's going to be their best art form.
I always had a real interest in efficient function, what is optimal. It was a passion for me through most of my life to view human structure and just to say, for that individual, what would it be for them to be able to function at their optimal state? I was lucky enough after I graduated from my PT school to go to Kaiser Vallejo, where world-famous physical therapist Maggie Knott was teaching, and I got to take a year-long program studying under her in a residency, and then was able to actually stay for another 6 years. And those years were very instrumental for helping me to develop the concepts, along with a lot of extra study and then just a passion to help people improve. Absolutely. Physical therapy in the United States, as a general rule, does not present the FMT concepts in the undergraduate. Now, Charles, as you saw in a previous interview, actually had quite a bit of training during his undergraduate because we were teaching courses at Hunter College, where he went to school. But in most cases, this is a postgraduate adventure or a task for physical therapists to be able to actually learn functional manual therapy, and they need to come for extensive training after the time that they've received their physical therapy degree. FMT is probably one of the fastest ways to give somebody a quick fix if that's what they're after. And so the mindset of the individual is a very important component of making the determination of what our long-term goals will be with them. There's a lot of individuals who really have a desire to overcome their problem completely and not just get out of pain. There's a lot of individuals who desire to function at a much higher level. And those are different paradigms of treatment that we would apply than somebody who comes in and says, my neck's hurting, can you get my neck out of pain? And we can provide them that care.
Oh, I was going to say, for example, an example is a football player that had come to preseason and within the first week injured his shoulder, was completely taken off all of practice. It was his first year. He had a full ride at a college, and he was not, at this point, the physicians were saying he probably wasn't going to get to play, and he was receiving your standard care for about 3 weeks and really not getting better. And in his mind, he probably epitomizes the need for the quick fix, because if he didn't get his shoulder fixed right away, he wasn't going to be on the field to play that fall, and that was going to ruin his whole collegiate career. So Greg and I saw him once, and in one treatment we were able to zero in and determine what the exact cause of the problem was, and the next day he was back on the field playing. So yes, there are those patients who have a need as well as a desire for a quick fix. And sometimes the pathology, the underlying pathology, only needs a short intervention. And in those patients, in those types of patients, we're able to serve that purpose. The problem is that even in that situation, having the training to know where to go and where to put your hands and how to determine what the true cause of the problem is, that's the advanced training that we bring to the table. So whether it's someone that needs a quick fix or whether it's someone that has a very complex dysfunction that's going to take many months or even years of intervention to help them achieve their potential, in both situations it's our philosophy that to be the most efficient at what we do, we have to have the knowledge and skill to be able to zero in with our hands and our knowledge that we bring to the table from our education to find the source. a whole body and that we should look at everything, but what's more important is to understand how the body functions as a whole. Part of that comes from our knowledge, that we study extensively the interrelationships anatomically between the different parts of the body, between the different physical structures of the body, such as the knee. What is the physical relationship of the knee biomechanically to the hip and biomechanically to the lumbar spine? So if someone walks in the clinic and you look at them track their knee over their foot and you see an internal rotation of the femur, you know that that internal rotation of the femur is going to cause a translation of force in an abnormal way up through the spine because of all the research that has been done on the biomechanics of the body. So we have a baseline of knowledge that guides us, but then our hands guide us. We can place our hands on the knee and feel it move and feel how those forces are being translated to other parts of the body. If someone has a colon dysfunction, you can go in and actually trace and isolate the scar tissue or the lack of mobility of the colon. You can actually feel that with your hands all the way to the structures of the lumbar spine. So there is a way to actually trace and isolate these connections and establish them. Sometimes we treat a dysfunction because we know anatomically there's a relationship, and then we evaluate to see if the outcome was in fact beneficial.
Use of our observation skills are sometimes an essential aspect of us being able to see how somebody is moving. Just having them come from sit to stand, or watching them walk, or an athlete watching them perform their athletics. There is a state in which all of the joints should be functioning efficiently, that the motor system is coordinated in a way that helps them to accomplish the task that they're after. So we train ourselves and we provide training so that our observational skills can help to identify what parts of the body no longer are functioning efficiently. We've studied every bone in the body to know exactly how it should function in its efficient state. Also, through our hands, we can palpate the individual joints, and each one, when they're healthy, has a pliability and a mobility to it that's optimal. But in many cases, after trauma, it loses that movement. And so we have tools that we can now to reinstate those joints to efficient movement. We look at the soft tissues, and soft tissues that have been affected by trauma and scar and other things lose their adaptability, so that muscles that are designed to slide on each other now have lost that efficient interface movement that we would be after. And we have tools and techniques to reinstate that movement within those soft tissues. And then we also are able to identify if they lack that core first strategy. And then we also have procedures that we utilize to help to facilitate that core to automatically fire in its proper timing. And then we work on coordination. So all of these aspects come through our observation and our palpation skills. So in the viscera itself, the viscera has a real pliability that has to exist. It has a motility that occurs within it. And we have tools and techniques that we can now be able to palpate and work with that viscera to make sure that it's got its optimal state of mobility and motility.
One of the things I like to teach my patients and other therapists that I train is that we live our whole life a lot of times antagonistically to gravity. I mean, we can't escape gravity. It's one of the forces, gravity and death, on this planet that you really can't escape. And so my goal is to help a patient become friendly with gravity. And if we think about what gravity does to the body, it's a force exerting a pull throughout our whole system. And so what we try to do is to develop a structure that works in harmony with gravity, that allows gravity to exert its force on our system with the least amount of stress. And so if you understand the biomechanics of the system, you understand how gravity should exert its force on your system, whether you're in sitting, whether you're standing, whether you're doing an activity at play or work. They're all throughout life, even when you're lying down sleeping, gravity is exerting a force on your system. So what we're looking at is we're trying to constantly understand how do we better position the body and utilize the body so that we do work in harmony with gravity. Well, yoga and Pilates are methods of enhancing function of allowing for a way to find time during the day to do meditation, for being more balanced in your system. But those systems require an efficient, functioning body. In other words, if I'm going to go in and do Pilates and I have restrictions in my shoulder or my knees or my lumbar spine, then I might be constantly compensating while I'm attempting to do my Pilates workout. If I practice yoga, but I have difficulty assuming a proper position because of restrictions or tightness, then I'm not going to get the full benefit of the meditation of the yoga or even the exercise benefit of the yoga. So we see that we are able to hopefully enhance one's ability to do both Pilates and yoga. On the reverse side, Pilates and yoga bring something very important to the table as well. They bring aspects of healing and aspects of healthcare that complement what we do.
It is one of the biggest challenges. Research has shown throughout the years that patients do not follow their home program. The majority of them do not. For me, I have an agreement with my patients before they receive anything. So I just believe that there has to be a relationship set up with the individual who's coming in for care, and you need to be able to set up, are you willing to do 15 minutes of exercise a day? And get that agreement, and it changes the context in which we actually provide our treatment, is that patient's involvement in that area. So I would much rather give somebody 10 minutes of exercises to do that they do, even if they need 20 minutes a day. I would rather be successful at getting those 10 minutes.
I think the fundamental principle that we have as functional manual therapists is that we are about changing people's lives. And so, because when you make a change in their body, you make a change in their life. And so for us, like one of the things that we've developed over the year is something called core first strategies for posture and movement. And, you know, everyone talks about using the core, but a lot of that is done volitionally. And how do I think about making my core fire? And what we do is teach our patients postural and movement strategies that allow their core to fire all day long. So if everything you do during the day is allowing your core to fire, then you don't need to lie down on the floor and do 45 minutes worth of core exercises, because you've exercised for 18 hours when you go to bed at night. So our job is to make sure that their life is in fact in itself an exercise. But the other area is that we really become very familiar and analyze our patient's life, what it is they do for work or for play, whether they're a full-time mother or whether they're a high-end executive. We dissect what it is they do during the day, and we help them to discover, if I'm on the phone for an hour at a time, I can be standing while I'm on the phone and doing certain stretching exercises. I can be doing certain exercises to strengthen my legs. There are all sorts of things that I can do that can be incorporated into my daily life, so that the idea of exercising does not become another element of stress in our life. And I think that's one of the things that has happened. People ask me, because Greg and I, with our professional responsibilities, travel continuously. And we work very long days, but we have learned that exercising is a way of life. It literally is your life. And it's a matter of walking a few steps instead of riding, or not getting on a moving sidewalk when you can walk beside it. Those little things can make a very big difference in life.
I think it's because of opportunity. India provided us the opportunity, it provided us a population and a group of individuals who are interested in us being able to provide our care here. So we're so excited that we have this, and India, we feel like, is just that next forefront for us to be able to expand our concepts in. I don't know that it's lacking here. I just think that there is another dimension that they haven't had the opportunity to learn. And that's our purpose, is to really try to provide the populace widespread ability and access to this concept that we've developed.
Approach, or the systematic approach of treatment that functional manual therapy encompasses. Because a lot of people say, I do functional manual therapy, and it makes it sound like functional manual therapy is a technique. And functional manual therapy is really a system of techniques. It's a systematic approach to the human body. And so it is a new concept for the therapists in India. In fact, it's a new concept for therapists around the world. My husband and I just presented at the World Physical Therapy Conference in Amsterdam this past June, and we were presenting to therapists from many, many different countries on the concepts of core first strategies and functional manual therapy. And the continuous response was, this is so unique. You're looking at the body in a very different way. And I was just teaching a course this past weekend in the U.S., and I had therapists that have been practicing for 20 plus years as physical therapists and very in-depth studying and even teaching themselves, who came up to me and said, no one has ever phrased how to use the body in this way. The way that you look at the body is so unique and so different. And so I do think that we are bringing something very special and very unique to the physical therapy population. And for me personally, that's what made it an exciting opportunity, because as a physical therapist, I'm very proud of what I do, and I'm humbly blessed by the opportunity to change someone's life through my skills and my techniques. And the therapists that I've worked with already here in India, they feel like their lives have been changed already, because they, as physical therapists, now have an even greater opportunity to bless those around them with an even greater potential for healing and changing their patients' lives. And to have the potential to change an entire country's perception of physical therapists, or better yet, to change an entire profession's perspective of itself, that to me is an opportunity that I see as unparalleled. Yes, Vardhan is going to offer a very unique setting at all levels of care. And again, it goes back to that integrated approach that we're bringing. And I think it's also important to note that as you study, as a physical therapist studies functional manual therapy, that it takes many years to become a certified functional manual therapist, of which both Charles and Javine are. And there are just under 200 certified functional manual therapists in the world. And Vardhan is the only clinic in India that will offer the services of functional manual therapy and of certified functional manual therapy. And then their history as physical therapists for both Javine and Charles is very integrated with healthcare such as Pilates and yoga. So they're going to be working very closely together with the care that is provided in these other supportive areas to make sure that we're always working as a team. So if I have a patient, or let's say if Charles has a patient that he feels needs to go through Pilates for part of their exercise training, he's going to have a very important consultation with that Pilates instructor to make sure that they're doing exactly the right exercises and focusing on the right movements while they're going through their Pilates training. Likewise, if some of our patients are in the yoga classes, they're going to talk with the yoga instructors and tell them the precautions of certain patients. So I do think we're going to see a very high level of integrated care that's going to set Vardhan completely apart. Well, I think it's important to understand that we are bringing to India an existing training process. So not only does the Institute of Physical Art offer post-professional continuing education, which we've been doing for now over 34 years in the United States and abroad. We train people in Japan and Europe and other areas of the world. But not only do we bring those existing courses, but we also, in the United States, offer credentialed residency programs and a credentialed fellowship program that we have been doing for now, the fellowship program, for going on 14 years. So we have in place a system of taking someone not only through the continuing education courses, but we have developed a very in-depth mentorship program so that others can learn how to be mentored, and others can learn how to mentor. So Charles and Javine both bring to the clinic the ability to provide mentorship, and they in turn receive mentorship from Greg and myself. And so there's a very established process and methodology of training that has been in place for many, many years. Some of the types of patients that we've seen that have had changes in their lives because of this three-dimensional approach to the human body, the physical, the spiritual, and the emotional. And I can just give an example from just this past weekend when I was teaching in San Diego, and a woman who was in my class who's been practicing over 15 years as a physical therapist, and we were working with her to learn how to assume an alignment that would allow her body to have this core first strategy. And as I placed my hands on her, tears began to fall out of her eyes. And all I was trying to do was to get her to relax and learn to breathe in her abdomen and allow her body to balance. And she just began crying and saying, "Oh my goodness," she said, "I didn't realize how much I was holding here. I thought I was just holding my muscles tight, but I realized the moment you touched me that all these emotions that I've been holding about the death of my mother that happened a couple of years ago, and everything was there." And I said, "That's okay. This is part of the healing of your body. Just let those tears come out and just let the body find its place of synergy." And so there's a unique moment that happens when you're working with someone, when that all comes together, when they realize that the human body is very complex, and it's important for us as functional manual therapists to provide an environment that's safe for someone to go through that process and to discover how to allow themselves to heal as a whole human being.
There are so many examples that it'd be hard to find just one. We have individuals who had struggled with back pain for their full life, now back to full living. We have individuals who have had balance problems and vestibular problems that we were able to help address some of their complex needs so that they now are back able to play sports without having dizziness and nausea affecting them. We have many women who weren't able to conceive that we've been able to treat their viscera and their organs to assist them in that process. So there's so many different components to functional manual therapy of whatever it is in the physical body that someone has problems with. We've found mechanisms in which we can assist them and to try to help them overcome their problems.
Like an example, a patient that we just saw a couple of weeks ago she was a semi-professional tennis player and had not been able to play tennis since 2002. And in just 2 treatments, she just played for the first time last weekend. And in 8 years, it's been 8 years since she played tennis. And so there are just examples over and over again that we could give you. And it's an awkward position because we don't want it to sound like we're tooting our horn. That's the last thing that we want to do, because Greg and I have always been very humbled by the gifts that we have to help touch other people. But on the other hand, I think it's important to put it out there because we want people to know that there is a potential, that there is hope. And I'll never forget this one woman that we were treating about 4 years ago in a class in front of a large number of people. And at the end of the treatment, she looked at Greg and said, "For the first time in 15 years, I have hope." She says, "No one has ever said or done anything to me to give me hope." And that's so critical. So sometimes a person hearing or reading that someone with a really bad knee problem began to walk more efficiently, or someone with chronic back pain for 20 years now has less pain, or someone that couldn't play tennis is now playing tennis again, sometimes hearing that testimony or that story may encourage them to at least seek out care. And as Charles and Javine said, we're not about trying to just treat people if we don't know that we're making a change. And we usually know very quickly that we're going to have the potential to make a change in someone's body. Or maybe this is someone who should in fact go back and see the physician. But we help people discover, is there hope?
Well, both of us know how important it is, particularly as you get into your 60s like I am, how important it is to be able to stay active and to keep yourself as healthy as possible. And Vicky's already kind of shared that whole concept, is that if you sit efficiently, you are already doing some exercise. If you walk more efficiently, and we work with this with our patients, so that walking as itself can be a form of exercise and training for the body. And I think these are just important aspects. For us, There are some sports. I love to play golf, and I'd love to be able to have more time skiing and other things. We live in a ski resort, but we don't necessarily have time for recreational sports as much as we'd like. So as much as we can, we're in the gym. As much as we can, we get out and we do walks and hikes and try to enjoy nature.
And I think that brings up kind of a good point for everyone, is that sometimes even exercising and doing a regular routine 4 and 5 days a week can sometimes be detrimental to the body. It's almost more important to have a diversity within your exercise. So some days going to the gym, some days going for a walk. Even if you put your shoes on, if jogging is something or running you can do, you don't have to do the same thing day in and day out. In fact, the research shows that if you vary your approach to exercise, it's better. So some weeks, Greg and I will go out and run a couple of days a week. Other weeks, we'll find ourselves in a gym exercising on equipment. And other weeks, we'll just find ourselves having time to walk down the long aisles at airports. But those are the things that we do. We grasp onto every moment we can to exercise.
The research over the last 20 years has just been unequivocal in understanding the role of diet in physical health. For many pain patients, an underlying component of that pain is an inflammatory process. We now know that the foods that you eat can accelerate that inflammatory process, and that we need to understand what foods you need to eat to help to calm down that inflammation, how the use of ice is such an important aspect of it. And so now that we understand that the health of the tissues, when you have a trauma, you need to have repair. There are certain foods that if you eat those foods can help to enhance the repair process. And so those are all components that we have to bring in for a full, complete treatment strategy, is to understand that nutrition, provide feedback to them. Now we're really realizing some recent research that just something like concentrated cherry juice has such high anti-inflammatory components to it that for many individuals they're able to stop their pharmacological drugs that they're taking when they start with this concentrated cherry juice. Eating salmon with high, eating salmon with high omega-3s is a very important component, and reducing your intake of omega-6s. So we do provide feedback in this area, but we always would prefer for complex patients to have a trained nutritionalist be able to assist us in understanding the proper role of nutrition for that individual patient in their health. Pain is a major disruption in somebody's life. If you've ever experienced acute pain, you realize that the activities of your life dramatically changes. If you get an acute headache, it's very hard to function and enjoy your life. So acute pain, that transitional pain that happens in some individuals, can be a temporary disruption of their lives. And we do have many techniques and approaches that can help diminish the length of time that it lasts. Research has shown that the average person in acute pain, that 90% of them will automatically resolve. Our goal is to help them resolve that acute pain faster. But it's really the chronic pain population that probably we're most attracted to, the ones that we are most dedicated to, because their lives are daily changed by their pain. We know of many individuals whose lives were just put on hold because they started developing a back problem and they could no longer be able to do their job and function within a family setting to the degree. We have many headache patients who just having a headache change their environment. And I think that it's an important aspect to recognize as a physical therapist that individuals with chronic pain not only alter their own internal emotional and mental state, but they impact everyone in their home, in their community, at their work. And so we have to see our job also as a component of rehabbing that environment, because we see changes. I had an experience one time of a young girl that I was treating at the training room in Steamboat. who came in and said she knew me, and I asked her how she knew me, and she said, well, you changed our life. My mother had such horrible headaches that living at home was very difficult. My father was ready to divorce her. We were having so much difficulty. And after just seeing you 2 to 3 times, it changed our whole life. My mom and dad are madly in love now. I love going home. We have dinner on the table every night when we get home, and it's a changed environment. And experiences like that can help teach us the importance of being able to have skills and tools to offer those with the chronic pain situation. I think it's important that we clarify that as a physical therapist, we work in conjunction with the surgeons. So the first aspect that we have to always say is we will provide the care that the surgeon would desire to have for his patient. We do have many concepts that we apply in those post-surgical times, both for the management of the scar tissue and for the facilitation of the core muscles, which we know post-surgically become inhibited and are no longer functioning. So we have a whole system that we apply post-surgically that we think are unique to functional manual therapy. But we're very capable within the Verdun Clinic of being able to apply the techniques that each individual physician would desire in their post-surgical care.
The exciting thing is that what we've learned with our experience and the 35 plus years of striving to always provide that higher level of PT care in terms of the efficiency and optimum potential for the patient is that there are really 2 types of post-surgical rehab. There's the one where a patient is just given exercise and a little hot packs or ice and occasionally a little electrical stim. And then there's the intervention where we take that post-surgical patient and we treat them like anyone else. We make sure that no patterns of dysfunction develop secondary to the surgery. I mean, when you have surgery, tissues are cut, and when tissues are cut, scar tissue develops. And scar tissue is a very nasty thing, and it can just, you might have a surgery in one place, but the scar tissue can weave its way throughout your system. And it's our job to help prevent future episodes of pain or dysfunction because post-surgically the patient didn't receive a really thorough assessment and treatment of the potential problems that could develop after that surgery. So when we do our post-surgical care, yes, we're trying to make sure that they recover, that they regain use of that arm or that leg or wherever they had their surgery, but we're also looking at it from a preventative standpoint. Again, tying onto that same theme that optimum health can often be promoted, not just restored, is that I've done a lot of work in the past with large organizations where the work environment does cause chronic abuse to the body. It's like Javine mentioned earlier, if she has someone who has to work overhead all the time, that is not good for the body. But there are ways that we can teach people to minimize the stress. So I've worked with people who work in underground mines. I've worked with large companies related to electrical work, dealing with having to do a lot of heavy lifting. But even if I just take like the average office worker who's on the phone continuously, little things that we can teach the person about how to sit, how to use a phone so they don't develop a chronic neck problem from always being on the phone, or how to wear an earpiece in a way that it actually fits their ear. I mean, there are so many things that we have discovered that can help a patient take ownership of their body and eventually, hopefully, prevent issues from occurring. There are also the areas of prevention in terms of optimum performance. So I say it is prevention, but it's really promotion of optimum performance. We see a lot of high-end athletes. We see a lot of people who run marathons. I know the record was just set this past week. And so what is it about that gentleman from Kenya that allowed him to run that marathon in just over 2 hours when no one else, 20-something seconds faster than anyone has ever run that marathon before? Why is it, what is it about his body other than the natural function of his muscles? We want to study the human body from that perspective, and we take what we gain from that study and we try to incorporate it into our treatment of other people who run marathons. So we've had marathon runners take as much as 40, 42 minutes off of their marathon time by being treated with a functional manual therapy approach. We've had swimmers take time off their swimming when they compete. We've had ski racers take time off their racing when they compete because we've treated them with this approach of optimizing the function of their human body. So I think the exciting thing about functional manual therapy is that we're not just treating people who are sick or people who have pain. Life is too short to wait until you have a problem to discover your potential. We want here at Verdun and in India to plant the seed that everyone deserves to be functioning at their optimum potential. Then sometimes you just need to give yourself permission to come in and say, is there more that I could do for my body? Can I function at a better level? Well, I think we've treated people from many, many different countries that have found their ways to either our clinics or those clinics of the therapists that have become certified through us. Within our network or our IPA family, many of our certified functional manual therapists are world-renowned because of the care that they deliver as a functional manual therapist. Some of them take care of international athletics. Others take care of those in the movie or the media industry. We take care of a lot of people that are internationally involved in the finance industry. And so there's a lot of ways that we've impacted patients throughout the world. In terms of taking our courses to other countries, both Greg and I and designated faculty within our organization have presented in other countries. We've presented in South America, in Europe, in Japan. And so that part of our company is growing. In fact, last year saw the establishment of what we now call the IPA world, because we are now becoming very active in trying to influence patient care in other countries beyond just the United States. But I think I would like to bring to point another area that we're becoming very involved in is research. Because as our profession grows worldwide, and as we become more independent as healthcare professionals in our ability to deliver physical medicine and physical patient care, we have to be very knowledgeable in why what we're doing works and how what we're doing works. And so in 2007, we began to develop the path to establish a nonprofit organization, which was finally approved in 2009, which is the Functional Manual Therapy Foundation. And it's a nonprofit organization that serves in many ways to further our knowledge and understanding of functional manual therapy. We're currently involved in doing research right now at Stanford, at the University of California, San Diego, at Long Island University in New York, and through other institutions as well, trying to understand the basics of how what we do works and why it works and why we should be doing what we're doing with patients. In addition to that, our foundation also helps to support the post-professional education of residency and fellowship training.
Well, I think that any system that is of value has to be a fluid system. It has to have a system that is always adaptable to change. There is an amazing amount of research going on in this world right now related to physical therapy. And each month I review probably over 500 articles. I don't get to read all the articles, but I read the abstracts to see which ones really are applied to functional manual therapy. There are research projects that have come out and literature that's being released that supports what we've been doing, that enhances it, but sometimes it also helps to clarify our approach. And so it's very important that we be able to be open to the most present and recent evidence for what functional manual therapy can provide. That's why it's important for us to be doing research. It's why There's always that opportunity of looking at what the present research is, but there's also that challenge of the clinic. Need is the mother of invention, and there are times where a patient will present with a problem that Vicky and I have no idea exactly what we're going to do. But we have the determination that we're going to find ways to help that person have a more whole and complete life if it's available to them. And so the approach is constantly developing. A large number of our certified functional manual therapists had to recertify again. And part of their recertification was coming back to review the coursework if they hadn't recently. And every one of them said, we can't believe how many changes have occurred in this approach in the last 10 years, that it is really growing. I hope the next 10 years provides that same, because it's our determination to continue to become the best that we can be.